interim president and CEO for Mosaic Clinically Integrated Network and medical director, occupational health at Henry Ford, Dr. Courtland Keteyian. Welcome back to the show.
Thank you.
So your title didn't change, but the name of the organization did.
Yeah, we're just trying to keep everybody on their toes. So we built on what was, I think, a very, really an incredible legacy here in Jackson of population health. And so we had what was the Jackson Health Network in Jackson. So basically all of the physicians, the majority of the physicians, about 95% of the physicians in Jackson County are part of the Jackson Health Network. We're part of the Jackson Health Network. And so now that we're a part of Henry Ford, we kind of got to the step where we needed to integrate all of our networks across the system into one thing. And so we elevated that entity, that Jackson Health Network entity, to make it, it was the Henry Ford Health Clinically Integrated Network, which was kind of a placeholder name. And we've settled on, the board has settled on the Mosaic Clinically Integrated Network, which is intending to reflect the pluralistic nature of the network. So it's not all doctors employed by Henry Ford. We have all these other partners that we work with. So in Jackson County, about half the doctors of the network are independent doctors in the community. Other half are part of the medical group. We have doctors in Southeast Michigan now that are in private practice. And we also have our partners up at Michigan State. So the Michigan State docs are all, MSU Health is all in. So in total, it's almost 5,000 providers.
Wow.
And about 500,000 patients who are aligned with our primary care doctors. So it's the largest network of this type in the state, and it's one of the largest in the country.
And from what I've been able to tell, it's designed to improve patient outcomes, improve overall community health, and lower the costs of healthcare. Of
healthcare. So we talk about in healthcare what's called the triple aim. And so the triple aim is three things. It's improve the health of the population, so the quality of the care we're providing. Mm-hmm. It's to reduce the cost, to do it for less money, and improve experience. And so really make the experience that people have, that patients have with care better. And so that was really kind of the driving principle behind the Jackson Health Network, which started in 2011. And now that is the driving principle for the Mosaic Clinically Integrated Network at a much larger scale. What's really cool is we've been able to look back now over the decade plus of JHN in the Jackson community, and a lot of the things we've done. So we can benchmark against other regions of the country to say, how does our quality compare? And our quality outcomes for things like cancer screening, chronic disease management, so how controlled is blood pressure, how controlled are people's diabetes, those types of things.
A lot of preventive.
Yeah, a lot of preventive care. So we are at the floor, 75th percentile, and for most indicators around 90th percentile. So in aggregate, this is actually one of the highest quality communities in the country to receive primary care. And people wouldn't really know that, but we can compare ourselves nationally to how folks do. And so that those processes, those operations are now being deployed at a much bigger level.
So you know how property insurance rates are calculated in part on an aggregate of the community based on experience. Does healthcare insurance get
Yes, actually, yeah. And they actually do, they actually usually rate, well, for commercial insurance, the rating is based on your employer because that's who's doing the purchasing. And so, and then outside of employer-based insurance, there's the market, which is a very kind of small segment people buy from the ACA marketplace. And then you have either Medicaid or Medicare, right? So Medicaid and Medicare don't really, kind of the rates are the rates. But for the employed population, people that are working to get their insurance from their employers, how healthy that population is absolutely drives premiums. Absolutely. It's how they determine the cost.
All right, well, here we are, hopefully close to the end of winter, but we've had really some super cold weather. Is that contributing to what has become the worst flu season in 15 years?
The temperature, probably not. Yeah, the whole concept of like you go outside in the cold and you catch cold.
My mom would tell you we can catch a cold.
That isn't how that works. But what it does do is we end up all inside, right, close to each other, and that's where we end up transmitting flu and other things back and forth. And so this is actually the worst flu season that we've had in a very long time. So the 2017-18 year was pretty bad. 2010 to 11 was the worst we've had, so it's 15 years ago. This is the first year we've had what's called a high severity season since 2010-11.
Well, I think what's interesting is we became used to practicing health habits during the pandemic, which would also, I would think, contribute to a less likelihood of transmitting or getting the flu. Have we forgotten to do those things, or?
I don't know that I've seen any studies that actually looks at like, are people better at washing their hands and covering their mouths or things like that with post-COVID.
I know the lines at the coffee shops. We used to stand like 6-8 feet apart from people. We're slowly getting tighter and tighter.
Getting tighter together. I think that probably the biggest driver is that is what we call vaccine hesitancy, where people are less comfortable getting vaccinated.
And that's a result of the pandemic too.
Yeah, I think so. So this flu season, there's actually more people in the hospital from the flu right now than there is from COVID. So COVID has been kind of our leading upper respiratory / hospitalizing illness for the last 4 or 5 years. And right now it's influenza, specifically influenza A. And the hospital here is very busy.
You're full.
It's full all the time. So, and what's really driving that is the flu season. Roughly, well, I can tell you exactly. So, because we track these statistics, adults in this community, in our network here, are vaccinated. Our vaccine rate's about 29% for flu vaccine, which is not where we would want it. That's pretty low. And the vaccine is any given season between 40 and 60% effective at preventing flu illness. This year is probably a little more on the lower end. You don't really know in season, kind of after the season how effective it was. But they're also more effective at preventing hospitalization. And so that's what we're seeing. We're seeing a lot of people that are not vaccinated who are ending up hospitalized. And so I think that's really the message is if you haven't gotten a flu vaccine, there's still, this is still a window to go do that, right? You should go get a flu vaccine because you don't want to be one of those people that are in the hospital, especially if you have other chronic diseases. All of those things increase the risk. Adults don't think about it. There's a lot of adults with asthma and other chronic conditions that increase their risk with COVID, right? So people with high blood pressure or heart disease or any underlying lung disease. People who are smokers, almost 20% of the population here in Jackson County that are adults use tobacco. So all of those things increase your risk of a bad outcome if you get the flu.
Yeah, so bottom line is you just don't want to be in the hospital, and the flu vaccine, while you might get the flu, it won't be as severe.
It won't be as severe, yeah.
Now, a couple things. So we've got, a couple more months where we could have the flu still active?
Yeah, typically as it warms up and people aren't as congested inside. And so we typically see flu activity trail off in, March, April. And I would expect that'll be the case again this year, yeah.
Last week, the CDC quietly suspended their marketing efforts to encourage people to get the flu vaccine. What do you think about that?
Well, I think there's a lot of things happening in the federal government right now that are hard to sort of interpret and predict what's happening. So it's hard to say. Obviously I want there to be as much information shared with the public around things that are good for public health. Flu vaccines would be one of those. But I also think that people know, like they know this is a good idea. And I think we've made it really easy for people to get vaccinated. You can do it at your doctor's office, you can go to any pharmacy. A lot of people's employers, like we actually partner with a tremendous number of local, we the hospital, with a tremendous number of local employers, larger employers here in the community to do flu shot clinics. So people can get vaccinated like at work. So we really tried to make it easy for people, whether the government is advertising it or not.
I think you got a great point there. A lot of people are suspicious of the government, regardless of politics. That the government, we don't want the government telling us what to do. But you're right. There's a lot of information that's available to someone who wants to take the time and talk to experts or their doctor or hear from doctors and make an educated decision. You can talk to
AI. If you have ChatGPT on your phone, you can ask it about vaccines, and it'll and you can say, what are cite the sources where you're getting this information from, right? I mean, there's a lot of ways you can get information. It's all out there, so people have to take some responsibility for that. Yeah, for sure.
All right, other things going on and going around. Measles, there's, I guess, a couple of outbreaks, and I think they're all in the Southwest. Is that something we need to be concerned about?
Measles is always something to be concerned about. So measles is a disease that had been almost completely eradicated. So we've talked about, so there's some diseases where we've declared like eradicated worldwide, right? Like smallpox, right? That was in the 70s was the last recorded case. And then we declared polio eradicated, which actually now we've seen cases of polio crop back up. And more globally than here in the United States, we've had US cases as well. Measles was one where we were sort of on the brink of declaring eradicated back in, as recently, this was like early 2010s. And so that is definitely not the case now. With less people vaccinated, we've seen cases increase. And so far this year, there's been 95 cases in the United States. Mostly in southern states, southern or western, so California, New Mexico, Texas, and last year there were almost 300 cases. So it's definitely something to worry about, and it's part of the normal childhood vaccine schedule. 95% of the cases are in people who aren't vaccinated, and measles is one where you can have very serious complications. There's a few percentage increase or a few percent risk with every case of measles to have long-term, very severe neurologic injury. And so people don't really think about that, but if it's a few out of every 100 people that get it, there's a few out of every 100 people that get it that are having really devastating long-term consequences. And those are not the things we really hear about.
We got measles vaccination, measles, mumps, rubella. There was a series when we were kids, and that still is effective and with us to this day. It's
the same vaccine. It's been around. I shouldn't say it's the same vaccine. It's the same concept, the same technology. It's been around for decades, this was the one where somebody came out with a study in the United Kingdom that was discredited, where they talked about the link between autism and the MMR vaccine. That's been completely debunked, and any of the ingredients, the main ingredient people were worried about is called thimerosal, which was a preservative, which is a mercury-based. Which I had a thimerosal, preserved vaccine when I was a kid, but that preservative has actually been removed. So the vaccines have been made, even safer, right, as time has gone on. So these things have been evaluated in millions and millions and millions of people. Very, very safe. Much safer than rolling the dice with getting measles and having really severe long-term outcomes.
And these people getting measles, are they younger people? Are they children?
It's almost all children.
All children.
Yeah, because most adults have been vaccinated still today. the thing with measles is it's the most contagious disease that we know of.
No kidding.
It's very, very contagious. So this is not hyperbole. You can have somebody with measles in a room sneeze, essentially walk through the room an hour later and get measles.
Wow.
It's very, very, as long as those droplets are still suspended in the air, you can still get measles. And so it's 2 to 3 times more contagious than COVID. It's very contagious.
But if you're vaccinated, your risk is...
The vaccine is almost completely effective. Yeah. It's 90+% effective. It's a very, very, very effective vaccine, much more so than, this is one of the knocks against flu and the COVID vaccines, right? Because those viruses mutate so quickly that our ability to essentially predict the right strain and make sure we're protected against it with COVID, the spike protein changes. With flu, there's just so many circulating strains. It's harder to provide that type of immunity, but with measles, it really doesn't behave that way. And so the vaccine has really been the same for decades, and it's extremely effective.
Measles is measles. There's not an Asian measles. There's not a bird measles. Nope. It's just measles is measles.
It's just measles. Yep. That's right.
All right, and you can still get COVID vaccinations?
Absolutely, yeah. There's right now the big ones there's all these respiratory things circulating, but there's 3 big ones that we see hospitalized, and it's influenza, that's the biggest. The second is COVID, and the third is RSV. And for all of those, there are indications to be vaccinated. The RSV vaccine, there's a new indication where elderly, but adults over 60 can get RSV vaccine now. You have a conversation with your doctor. So I would very much encourage people to have all of those vaccines, age appropriate. Talk about it with your doctor, but these are the things that are driving hospital use right now.
All right, appreciate the updates and the recommendations and guidance. Great to see you as always. Thanks for coming in.
Thanks for having me.
From Henry Ford, Dr. Courtland Keteyian. More